Obstetric examination is painless, friendly examination that should be performed on each antenatal visit to evaluate fetal growth. For a thorough examination, the examiner should introduce her or himself, wash their hands, and follow hand hygiene protocols. The patient should be requested to remove their clothes, but for the sake of privacy, limited adequate exposure to the area is recommended for private parts. The patient should be in suitable hospital gown. Patient permission and verbal consent should be obtained before any examination. Regardless of the gender of the physician conducting the examination, a female chaperone should be present. A thorough examination should be performed to evaluate the patient's general health, which could offer information that could be directly related to the main complaint. Patient should be informed about every step of the examination. After general examination, the obstetric examination will be conducted, starting with inspection. Look for any asymmetry, scars, pigmentations, bruises, prominent veins, cutaneous signs of a pregnancy such as linea nigra, stria gravidarum, stria albicans, and look for fetal movements. Moving on to palpation. Before palpating the patient, ask her if there is any pain or if she needs to empty her bladder. Then start with superficial palpation, looking for tenderness. Then you should measure the symphysis fundal height. Palpate the symphysis pubis and the fundus. Then measure the height between them using the measuring tape. The first maneuver is called fundal grip, which assists the uterine fundus to determine its height and which fetal part occupies the fundus. The uterine contour is outlined by placing both hands on each upper quadrant of the patient's abdomen while facing the patient. Using the fingertips, the fundus is gently palpated to identify which fetal part is present in the fundus. The breech gives the sensation of a large nodular mass, and its surface is uneven and not very mobile, whereas the head feels hard and round with a smooth surface of uniform consistency, and it's very mobile. The second maneuver is called umbilical grip or lateral grip. While still facing the patient, both hands are placed against the lateral uterine wall. Palpate using your left palm and push the right maternal side towards the right palm and vice versa. This allows establishing if the fetus is in longitudinal, transverse, or oblique position. If the fetus is in longitudinal position, the fetus back will be felt like a smooth, hard, resistant surface, and the small parts of the hands and feet will be felt like a regular nodulation. The third maneuver is Pollux grip. While still facing the patient, grasp the presenting part between your thumb and third finger in a C-shaped position just above the symphysis pubis to determine what fetal part is lying above the pelvic inlet and to determine the mobility of the presenting part. If the presenting part moves, this means that the presenting part is not engaged. The fourth maneuver is the pelvic grip. It's performed while facing the maternal pelvis. In this maneuver, the palms of both hands are placed on either side of the lower abdomen, with the fingertips of the fingers facing downward toward the pelvic inlet. It's possible to identify the characteristics of the part presented and confirm if the fetal head is encephalic presentation. The last step is auscultation. Listen for fetal heartbeat using Pinard's stethoscope or fetal stethoscope of handheld Doppler device.